Very good morning, everybody. Today we'll be starting with a new topic called survey procedures in dentistry. So, when we talk about survey procedures, you should not be confused with this topic called surveying, which we'll be studying in prosthodontics as well. Whereas here we'll be talking about how do you conduct a survey in terms of epidemiology or in terms of field work, how a survey is done. So, survey procedures in dentistry is a long essay question for you all, and we'll be discussing this under the following headings. First is the definition of survey. Next, what are the different types of survey? Third, what are the steps in conducting a survey? Fourth is what are the WHO index age groups? And the fifth is WHO basic oral health survey. So these are the 5 different topics that come under the chapter called survey procedures in dentistry. So first and foremost, let us go to definition of survey. Survey is a non-experimental investigation. The simplest definition for a survey is it is a non-experimental investigation. Rather, a proper definition of survey is an investigation in which information is systematically collected and no experimental methods are used. Okay, so survey is basically an investigation, and the method of collecting the information is in a systematic manner, and you are not using any experimental method. So, I repeat, the definition of a survey is an investigation in which information is systematically collected and no experimental methods are used. Now, we have come across survey in our day-to-day life. Okay, for example, you visit a survey station, and after that you get a feedback form. You visit a restaurant, you get a feedback form. So what we are doing there is all a survey. You are asked to share your information, and they will be giving you a questionnaire which you will be filling, and they will assess your satisfaction with their customer service. So likewise, there are a lot of surveys that is happening around us. Okay, so even for example, even the Filmfare Awards is also an outcome of survey. So that is because it is based on the viewers voting. You decide who should get the award. So survey is a day-to-day thing that we come across. But when we can use it for an epidemiological investigation, we need to understand what is the survey in context in relation to the healthcare context. Okay. So when you talk about surveys related to health, you can classify surveys based on 4 headings. Okay? The first heading is based on the number of times the data is collected. Okay? There are 2 types of surveys. One is called as a cross-sectional survey, the other is called as a longitudinal survey. As the name suggests, cross-sectional survey, the data is collected only once from a population. Whereas a longitudinal survey, the data is being collected from the same population multiple number of times. Okay, so cross-sectional survey is also known as the prevalence survey, whereas longitudinal survey refers to incidence survey. Now, the basic difference between incidence and prevalence is that prevalence is the total number of old and new cases in a given population at a point of time or over a period of time. For example, you go to a population, you suppose there is a population of 100 people, and when you check out their oral cavity, you find 50 of them have caries. The prevalence of caries in that population is 50 divided by 100. Okay, or 50% is the prevalence of caries in that population. Suppose you go to the same population after 1 year, and you find out 60 of them have caries. So the prevalence at that point of time is 60%, whereas over a period of 1 year, there has been an increase of 10%. So prevalence refers to the total number of old and new cases. You don't know whether the cases are new or the cases are old. So in this example, the prevalence when you go first is 50%. When you go after 1 year, the prevalence is 60%. Whereas over the period of 1 year, you have got a 10% increase in the number of caries. That new cases is called as incidence. So by this example, it is quite clear that you get an incidence only in a longitudinal study, whereas you get prevalence in a cross-sectional as well as longitudinal study. Whereas if you want an incidence, it has to be exclusively through longitudinal study. So in the same example, the prevalence survey means the cross-section survey, whereas incident survey means the longitudinal survey. This is the first classification. The second classification is based on how you collect the data from the population. If you examine their you do a health examination and you collect data, it is called as a health examination survey. For example, the thing I told you, if you want to know the dental caries status, you need to examine the population. So such kind of a survey is called as a health examination survey. There are some conditions where you need not examine, you can just ask the patient and do an interview and collect data. For example, you want to know the smoking frequency. Suppose you want to know what is the frequency of smoking, what is the age of initiation of smoking. You are conducting a study on smokers. You cannot examine these factors. You need to interview the samples and they will give you a response. This is called as a health interview survey where there is no examination but their data is collected by an interview. The third is, suppose you want to know how many patients have visited our college last year with dental caries. You need not go back and call all these patients and examine. You can go to the record section, collect last year's records, case records, and scrutinize, and that will give you an information about how many patients have reported to a college with complaint of dental caries. So such kind of a data collection where you don't directly involve the participant, whereas you collect the data from a record. This kind of a data collection is called as health record survey. And the fourth type of survey is, this is one of the common methods where if you want to if you want to do a research, there is a form of distributing questionnaires to find out the knowledge. So it is usually known as KAP studies, the knowledge, attitude and practice. You will come across many such studies during your curriculum. So this is one way of collecting data, that you are distributing the questionnaire and you are making the respondents answer to this question. This is the fourth type of investigation, which is called as questionnaire survey. So these are the first two classifications of survey techniques. The third classification is based on the study design. If your study aims to describe a condition, it is called as a descriptive survey. And if it goes one step ahead in analyzing the reasons, it is called as analytical survey. So suppose you want to know the dental caries occurrence, it is a descriptive study. Whereas if you want to know why caries is occurring so much, why it is more, why it is less, and if you are trying to reason it out, that kind of a study is called as an analytical study. So based on that study design, you can classify them as descriptive survey and analytical survey. And the fourth is based on population covered. If you are covering the entire population, it is called as census. You must be familiar with the term census. The government of India conducts census to collect vital statistics once in 10 years. So the last census was in the year 2011, and every 10 years the census is conducted by government of India, and that includes each and every individual in the country. Whereas if you are doing the survey on a selected sample, it is known as a sample survey. Almost all the surveys that are done are on samples except for the census. Okay, the census is not always practical. So census is you don't have a sampling, you cover the entire population. Whereas if you are doing a study on a representative population called a sample, it is known as a sample survey. So these are the four different ways in which you classify surveys related to health. The first is based on number of times the data is collected. It is called as classified as cross-section survey, also known as the prevalence survey, and longitudinal survey, also known as the incidence survey. Second is based on the type of data collection. If it is through examination, it is called health examination survey. If it is through an interview survey. If it is based on records, it is called as health record survey. Or if the data is collected by distributing questionnaires, it is called as a questionnaire survey. The third is based on the study design. It is classified as descriptive survey and analytical survey. And the fourth is based on the population covered as census survey and sample survey. Next, so this is what I have explained once again in these slides. The number of times data is collected, how it is classified, and how it is classified based on type of data collected, and how it is classified based on study designs, and how it is done in relation to population coverage. So the census is just a little more detail in case it is asked as a short note. Census is something which is done on an entire population, In India, it is done once in 10 years to record the vital statistics and socio-demographic details. It was first started in 1871, latest conducted in 2011, and the next was due in 2021, but due to the current pandemic, probably it has been postponed. But when it is done on a representative sample, it is known as a sample survey. So next, before going on to steps in survey, we need to cover another very important aspect called as sampling. Now, what is the meaning of sampling? For example, if you want to know your blood parameters, suppose you want to know your hemoglobin, you want to know your RBC or WBC count, you go to a lab, you just give around 3 to 4 ml of blood. Okay, maximum 5 ml of blood. But looking at that 5 ml of blood, they are going to give a broader picture of the 5 liters of blood in your body. So it's not practically possible for you to take all the 5 liters and analyze it for parameters. Instead, it is done in a 5 ml sample, and whatever observation is given in the 5 ml or whatever observation the 5 ml sample gives, it is put to the 5 liters of body. So this is what is happening. That 5 ml is known as a sample, and that sample has to be a proper representation of the entire 5 liters of blood in your body. So what is sampling? Sampling is the act or process or technique of selecting a representative part of a population for the purpose of determining the parameters or characteristics of the whole population. So it is not possible for you to probably conduct the study on an entire population. For example, you want to know the knowledge of dental students in Kerala regarding COVID-19. It is not possible, virtually possible for you to include all the 26 or 27 colleges in Kerala state, include all the students and conduct a survey. But you can definitely conduct it on a small number of people, maybe 1,000 population you can conduct. But what results come in that 1,000 population, you will be applying it as the knowledge of dental students in Kerala regarding COVID-19 is so much. Okay, so that is what is the purpose of sampling. Now, why do you do a sampling? Sampling is mainly done for saving on material, manpower, money and time, because it is maybe not practically possible for you to do it as a census. You need to go for a sampling, and sampling saves on the resources. The resources required for any study are material, manpower, money and time. Okay, next coming to a few terminologies associated with sampling. You need to understand this terminologies clearly. The first is called as the sampling universe or sampling population. That is the total number of items in the field of inquiry. Next is the sampling frame. That is the list of items from which the sample is going to be actually taken is known as sampling frame. And the third is called as sample, which is the number of items used for conducting the study. For example, I'll give the same example. I want to know the knowledge of dental students or say final year dental students in Kerala about COVID-19. Maybe on an average there are 24 colleges, and for simplicity we will take every college has 100 students. Okay, so it becomes 2,400 final year students I have. It is not virtually possible for me to call every 2,400 students and tell this. Instead, what I do is I keep a sample size of 500 students. And this 500 students I'll be doing the study, and I'll be putting this results to this 2,400 students. So in doing this, the sampling universe is this 2,400 students is called as the sampling universe. That is the population to which my result is going to be applied. Whereas I'll be just selecting around 10 colleges, maybe 1,000 students. From the 1,000 students, I'll be picking up 500 students. So these 1,000 students will be my sampling frame. That is the list from which I'll be actually picking my sample. And this sample of 500 is my sample where I'll be conducting the research. So if you go through the Venn diagram, the outermost circle is the sampling population. Next to that is your sampling frame. Innermost is called sample. And out of this 500 students, maybe only 480 students answer my question. So that is called as response. So each one is a subset of the other. Okay. So I'll stop this video now. I'll continue it in the next video. Thank you.